This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Last question, Prof. What are the current approaches for diagnosing and treating PCOS, and can alpha-lipoic acid treat PCOS?
No, relating to the last question about medications, there's nothing that can cure PCOS. PCOS is almost certainly a programming problem between the brain and the ovaries that was probably set up around the time of puberty. Many women with polycystic ovaries were overweight, were chubby teenagers. And what happens in chubby teenagers is that estrogen is produced from the fat, and that produces a disorder of the feedback mechanisms that allow regular ovulation. There's also evidence, and I did a study many years ago where we looked at women with PCOS and compared them with non-PCOS women, and the incidence of traumatic events in their lives around those teenage years was substantially higher in women with PCOS. So their parents breaking up, or a sibling dying, or moving house on a regular basis that was stressful to them, which increases cortisol levels, which also converts to estrogen, and so you get interference with the computer program that says you should ovulate every month. So once that's there, it's a computer program that can't be totally switched off. On an intermittent basis, you can, and that's so when we use drugs like clomiphene or letrozole, in that cycle, we are producing events that con the pituitary and the ovary to believe that things are back to normal, but it's not a prolonged cure. People have tried taking pieces of the ovary out or burning ovaries, and that turns the hormonal situation around for somewhere between 3 and 6 months, but it comes back. It's not a long-term cure. So there's no long-term cures for polycystic ovaries. How do we diagnose polycystic ovaries? It's a very broad group of patients. Something like percent, I think one study showed, women have an ultrasound picture that suggests they have multiple cysts in the ovaries, suggesting polycystic ovaries. But only 5% have a clinical problem. The clinical problem is usually irregular periods, and that also the hormone imbalance that occurs can lead to increased male hormones. So pimples, hair growth is another sign that there may be polycystic ovaries. Irregular cycles and what are called androgenic effects. When we go looking for diagnostic tools, obviously I mentioned ultrasound already, that's number one. Then we go looking at the male hormone levels in the blood. That gives us another clue if they're disordered. They're almost never in the male range, but they certainly are in the upper range of the normal female and just above. We may also measure something called AMH, which talks about the number of small follicles in the ovary, and in PCOS almost universally that's elevated. They're the sort of things that we go looking for when we're looking for the diagnosis of polycystic ovaries.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.